Philippe, thanks so much for joining us here today.
It's absolutely a pleasure to be here. Thanks for the interest in our work.
Yeah, definitely. So the last time we saw each other was in Tel Aviv, and I saw some numbers you presented there, and I was particularly interested in some of the numbers you showed about the different consumption methods that you're seeing. Can you tell us a bit more about that, break down the numbers and what we're starting to understand, specifically from Canada, but I guess from a global perspective as well?
Sure, I've been a cannabis researcher for about 15 years, and really the focus of my research looks at patient patterns of use and the impact of that use on the use of prescription drugs, alcohol, tobacco, and illicit substances. And in recent longitudinal studies that we've been doing, as well as some cross-sectional studies, what we're really seeing is a shift away from the inhalation of high THC products towards the oral ingestion of high CBD products. I think we all know that, CBD is a growing kind of a craze. There's a lot of interest in CBD right now. But what we did is we stratified from our study called the Tilray Observational Patient Study, which is the largest national longitudinal study of Canadian patients to date. We stratified the patterns of use based on age. And what we see is that this emergence of oral ingestion of CBD is very much age mediated. We see that patients under 25 are far more likely to inhale THC products as a preferred method of use, whereas patients over 55 almost overwhelmingly, to the rate of 75 or 80%, use oral ingested of CBD. And because that older patient group is one of the fastest rising groups of patients, not just in Canada, but around the world right now, it's swaying and skewing the data over to the oral ingestion of CBD. So it's really caused a big change, because if we were doing this interview 5 years ago and talking about medical cannabis, we'd really be talking about inhaled THC. But more and more, as we're talking about medical cannabis now, we're talking about orally ingested CBD.
Mm-hmm. It's really interesting also. I think it makes me think about the stigma or what people have in their minds when they're thinking about cannabis, and it clashes with that.
Yeah, I agree. And I think, I've been an advocate over the last 10 or 15 years to no longer say that cannabis does this or cannabis doesn't do that, because it really clouds the message. What we really need to start classifying what kind of cannabis or cannabis products we're talking about when it comes to both positive and negative effects. And a great example of that is when people say, well, cannabis is associated with psychoses. That's not actually true. THC is associated with psychoses. And I say associated, it's not causal, but if you have a predisposition because of familiar or genetic traits associated with psychoses or schizophrenia, THC can cause an earlier expression of that psychoses. It's not causal, but certainly it would be what we would call a vulnerable population in using THC products. CBD, on the other hand, is being studied right now for the treatment of anxiety and even more serious mental health conditions, and is not associated with psychoses. So instead of saying cannabis associated with psychosis, we have to be much more specific and start saying that THC is, either you can benefit from the use of this substance, or you need to be wary of the use of this substance. But we need to be clear about the breakdown between THC and CBD, and ultimately all the other cannabinoids that we're going to start studying and seeing in medicines as well.
Mm-hmm. Sounds like this is, where education comes in, both in terms of the public and I suppose like patients and lay people, and also within the medical community.
It's funny because I think that patients are still ahead of the game on this. We all know, I work with doctors all the time. You don't want to trust Dr. Google too much when you're trying to do self-diagnosis. But when it comes to information on cannabis and cannabis products, patients do a lot of research before they ingest anything. A lot of these patients who are early adopters of cannabis medicines are very concerned about the health impacts. They're more likely to believe in naturopathic medications or natural medicines. And a lot of the time they've had treatment failures using traditional pharmaceuticals. So they may be looking for simple alternatives to that. So I do think that the patient population obviously can benefit from education, but I sometimes, I'm led to believe that they're ahead of their understanding, certainly on things like the difference between THC and CBD or oral ingestion and inhalation, than physicians in new jurisdictions. So a place like Portugal, where there hasn't been a lot of exposure to medical cannabis, it took years for the medical community in Canada to start to understand medical cannabis. And even at this point, the overwhelming majority of medical schools in Canada will not talk about the endocannabinoid system. They will not. The only time that they'll study cannabis is as a drug of abuse, even in Canada with a 15, 20-year-old medical cannabis program right now. So yeah, that education really has to increase, but I think that we also need to make sure that we're listening to patients and their experiences, because they may be ahead of the game on this.
Interesting. So when do physicians learn about the endocannabinoid system? I like to think that a physician who's recommending or prescribing medical cannabis does have an understanding of the mechanisms. When does that kind of come into their knowledge?
Well, unfortunately, right now, physicians are left to their own largely to learn about these things. So there are a lot of companies, both licensed producers like Tilray, but also medical education companies who have developed curricula around medical cannabis, the endocannabinoid system, and physicians are, and also there's been a significant growth in publications looking at therapeutic applications for cannabinoids over the last 10 years. We're really seeing a renaissance of medical cannabis research these days, looking at both harms and benefits rather than just harms, which we studied for 60 years without studying potential benefits. So there is information out there, but we have to understand physicians are busy people. They get inundated by new drug development and having to learn about new drugs and new treatments as it goes along. And cannabis in many ways is just one other new drug that they've got to learn about. At Tilray, we use pharmaceutical reps, that kind of strategy to educate physicians. We've developed curriculum that physicians, pharmacists can learn from online as well. And of course, conferences like this really help a lot when they focus on physician education. And downstairs, a few floors beneath me right now, there's 40 or so physicians that are here all day to learn about the therapeutic applications of cannabis. It's growing, but it takes some effort right now from the medical community. It's not something that they're going to learn in medical school at this point.
Right. Well, it's good that it's happening.
Yeah, it is. It is. And I find, I've worked in a lot of different jurisdictions on medical cannabis, and I feel very privileged to have been invited to share my research with the governments of Uruguay, and I've been invited by the mayor of Bogota, and worked in a number of different jurisdictions to try and help them better understand medical cannabis as they develop these regulations. And so there is an openness and a desire to learn right now. But what I've learned is that different cultures and societies, and this isn't just unique to cannabis, they adopt knowledge in different ways and at their own pace. And we have to be patient with a society that's now being introduced to medical cannabis and how quickly that adoption is going to be. And typically the way that it starts is you have a few physicians who start using medical cannabis when it's legal. They get good patient reports and they become the knowledge bearers, and they're the key opinion leaders, and they can bring other physicians along because doctors love to learn from doctors. They're more resistant to learning from people who are not MDs. But once they hear about positive experience from other physicians, they're more open to these treatment modalities, and then there's a slow growth that happens. But it can take years for medical cannabis to become a common treatment in a society. In Canada, we've had a medical cannabis program since 2001, and right now about 18,000 physicians have prescribed cannabis on at least one occasion. That's about 20%. So by that definition, I think we can look at it as a really successful new drug. But that also means that there's 80% of physicians out there, despite 20 years of experience, who have not prescribed medical cannabis in Canada. So it shows the growth that's still needed if we're going to consider this a traditional or common part of the pharmacopoeia.
Yeah, definitely. What you mentioned before about patients being better educated sometimes than physicians, and then also what you're talking about with doctors preferring to learn from each other, makes me kind of think about the role of anecdotal evidence in this story here. What do you see as the role of anecdotal evidence together with preclinical and clinical research?
I think that's a really good question, because I often talk about, almost everything that we know about medical cannabis we've learned because patients have shared their experiences. So at Tilray, we've done a clinical study on medical cannabis for pediatric epilepsy, a medical cannabis preparation and oil that we did on pediatric epilepsy. We didn't do that study because we heard there was a mice model that suggested it might be helpful in pediatric epilepsy. We did that study because families had been sharing their experiences in treating seizure disorder with CBD and seemed to be having some success. And in fact, it was families sharing the fact that they found a little bit of THC to be helpful that helped us develop a formulation as well that contained a little bit of THC. So I think that science in many ways is trying to catch up to what patients have been telling us for so long. And I'm a social researcher, and I like to really differentiate between an anecdote, which is basically if you told me that your mother's sister's daughter cured her cancer smoking a joint. To me, that's an anecdote. But when you hear 1,000 or 10,000 patients say that it's useful in the treatment of arthritis, I think that raises above the level of evidence of anecdote. And there we're talking about what social research sometimes defined as community-defined evidence, or what's now being known as real-world evidence. And Tilray is committed to clinical research. We have 10 clinical studies either completed or underway, but we're also equally committed to gathering real-world evidence. And that's where these observational studies that we have going on right now, which are large-scale, tracking patients over, prospectively, or in some cases doing large-scale cross-sectional surveys, can really give us some useful information very quickly that can then inform clinical trial development as well. And the data that I'm sharing here and that I shared in Israel is from this Tilray observational patient study, which is a super large-scale real-world evidence study, but it gives us very clear indications about how patients are using medical cannabis in a naturalistic setting. And ultimately, patients can tell us a lot about what works best for specific conditions or what dosages are most effective by when you've got this large plurality of patients and can look at data over time, because patients will obviously not use something over an extended period of time that's not effective or that's causing a large series of adverse events. So in looking at patient use data in kind of an open label fashion like that can really provide useful evidence.
One of the things I find really interesting about kind of drawing this line between the recreational market and the medical market is that so much kind of medical use of cannabis verges on recreational, and definitely the opposite, that so much recreational use is often therapeutic, even if it's not, initiated for that reason. When you do these observational studies, do you look at recreational use in Canada as well, or only patients that have been prescribed medical cannabis?
My focus really, the focus of my research focuses on medical use, but I do ask a few things that I think are kind of fascinating. I ask about, in cross-sectional studies that we've done, and we just did the largest cross-sectional survey of Canadian patients to date in January of 2019. I'm writing up a few papers for publication right now. We asked about substitution, not just for prescription drugs, which you might expect in a medical community, but also substitution for alcohol, tobacco, and illicit drugs. Now, there's no one who starts using medical cannabis that says, I'm going to start using medical cannabis to deal with, to try and quit smoking tobacco. That's typically, only in rare occasions would you see a prescription associated with tobacco dependence. But what we do see is that those who are using tobacco, when they start using medical cannabis, report a significant reduction and oftentimes report quitting tobacco completely. And we see the exact same thing with alcohol and in a lot of cases with other illicit substances, whether it be illicit opioids, psychedelics, or stimulants. So to me, that shows that within a medical cannabis community, if we're seeing this substitution, along with epidemiological data in the U.S., in jurisdictions that have legalized cannabis, we're seeing a reduction in these potentially more dangerous drugs associated with, and a clear association with the legalization of medical or recreational cannabis. So I find it interesting that, and I suggest that we can't look at the potential harms or benefits of cannabis in society in isolation. We really have to look at the way that cannabis use and cannabis regulations impact the use of alcohol, tobacco, opioids, illicit drugs, because while we may see, as you legalize cannabis, a small increase in the amount or use of cannabis, if you see a subsequent decrease in tobacco use or alcohol use and illicit drug use and related problems, you actually get a net public health benefit. And I find that, really important for us to look at in conjunction. From a harm reduction perspective, if you shift someone from using opioids, a very harmful, potentially harmful addictive drug, to cannabis, then you've got a net public health benefit out of it. The other thing I wanted to mention in light of what you suggested earlier, in this cross-sectional survey, I actually asked patients, just a patient population, how much of your cannabis use is recreational and how much of it is medical? And they cited that the mean or the average that we saw is about 75% of the, overall, then it was a scale of 1 to 100. The patients suggested on average about 75% of their use is medical and 25% is recreational. So there's always been in the studies that I've done a clear distinction in those patient populations between what they consider their therapeutic use of cannabis and their medical use. And you see that also when you ask them, when did you first start using cannabis recreationally, which on average is about 16, 18 years old in Canada. And when did you start using cannabis medically, which is a much older age? And so patients, if not society, clearly distinguish between their past recreational use and maybe their current medical use as well.
Right, makes sense. This is really fascinating to me, what you're saying about the kind of overall health benefit we can start to understand. A year out after legalization, right, in Canada, do you have any understanding of the overall benefit on Canadian society?
Well, it's interesting because right now we're really geared towards looking for and expecting harms associated with legalization. And it's very important that we track. And Canada, when we looked before legalization came into place, we talked to other jurisdictions, including U.S. states, and they said the one thing they wish they'd done is gather more and better baseline data prior to legalization so that they could look at the impacts of legalization on public health overall. So in Canada, we did a bit of a better job of it. And what we've seen so far is encouraging. And the first thing that we've seen that I think is particularly encouraging is the early data on charges associated with impairment, impaired driving with cannabis have not gone up. And I think that's incredibly encouraging. And I'll tell you why it's particularly encouraging. Charges associated with impairment are different than mortality rates associated with accident rates. Mortality rates will not shift. They will shift according to policy, but they won't shift according to enforcement priorities. Impairment is typically associated with enforcement priorities. So if we look and have more police officers looking for people who are impaired of cannabis or alcohol on our streets, we find more people. In this case, we clearly had the police now looking more actively for people who might be impaired associated with cannabis. So the fact that we didn't see a rise in impairment is really encouraging from my point of view. I think it means that our public education messaging that we're doing about not driving stone is likely having some positive impact, because we know that police forces out there are definitely looking for it more than they did prior to legalization. So very encouraging not to see that. The other statistics that I think are really interesting that I'm looking forward to seeing in the next year are a bit of a Rorschach test for whether cannabis legalization has been positive or negative. The two things that I want to see that I think are positive indicators of the benefits of legalization would be increased ER visits and increases in people looking for treatment for cannabis. Now, if you're against legalization, you might look at that, listen to what I just said and say, well, that's a sign of things getting worse. More people showing up at the ER, more people showing up to try and get treatment for cannabis use. But prior to legalization, if you showed up at the ER and said, I'm too stoned, I think I'm going to die, I ate a cannabis brownie, it could lead to criminal charges. It could lead to a loss of employment. And then same thing with showing up, and seeing your doctor saying, I think I'm dependent on cannabis. That could have repercussions on your ability to travel, your work, etc. I'm hopeful that under legalization that more people will feel comfortable going to the ER if they're having an unpleasant cannabis experience, and that more people who might be having dependence issues with cannabis are going to seek help and treatment. So I'm interested in seeing over the next year if those metrics have shifted at all, because we haven't seen any reports yet associated with now us being over a year into the legalization experiment. The data that we have seen is interesting. What we're seeing is more and more older people are using cannabis right now, and that's the biggest news out of the latest Stats Canada report, is that older users are the fastest growing demographic right now in terms of cannabis use. So that's interesting in and of itself. And what we haven't seen are increases in youth use of cannabis, and that, of course, is encouraging, and one of the reasons to legalize and take control out of cannabis out of the black market is to reduce the use by youth.
All sounds really positive.
Yeah, for now. We'll see how it goes.
So we're here in Portugal at the Portugal Medical Conference, and Tilray has a large growing facility a couple of hours away from where we are now. Tell us about why Portugal.
Well, I think we looked around at a lot of different jurisdictions initially to see where in the EU would be kind of a welcoming jurisdictions and a good place to grow cannabis in terms of physical space. And Portugal had so much to offer in that area. We've got a highly educated workforce. We've got a very supportive government. We've got a country that's been a leader in drug policy by decriminalizing the personal use of all drugs about 20 years ago, and seeing the radically positive impact that's had on the rates of HIV/AIDS and Hep C transmission, increases in the folks who are willing to seek treatment for illicit drug use dependence. So it was a welcoming political climate. Where we've been located in Cantanhede, in a tech park called BioCant, is a phenomenal facility. And we've got this great workforce of highly educated folks who are happy to have full-time work in this industry. And we have now over 200 full-time staff. And I understand we've got another 100 folks on site working every day. So there's about 300 folks working up there on any given day, which is quite remarkable. And of course, just like in Canada, small, medium-sized communities where these large-scale production facilities get established end up reaping a lot of benefits. In Nanaimo, our primary facility, GMP facility in Canada, we've actually won the Chamber of Commerce Best Employer Award on a number of occasions because we bring these high-paying, very technical jobs and employment, as well as entry-level jobs, to a community that can really benefit from it. And we're seeing that in Cantanhede right now, where we're one of the primary private employers right now as well.
Mm-hmm. And the plants that are grown here, that becomes the products that are circulated around Europe or also back to Canada?
That's right. Right now our facility is at GMP2. We expect to have GMP1 before the end of the year, and we've successfully done an export of flower products already to Germany. Right now, most of our EU exports are still coming from Canada, but at this time next year, the whole goal is that the EU and frankly, a lot of our other international jurisdictions are serviced out of Portugal, which is a huge facility with indoor-outdoor cultivation, in order to redirect the energies of our Canadian production facilities to North America, Canada, and the US ultimately.
Okay. I want to jump topics. How did you get into the industry? Why cannabis?
For me, it started with a very personal experience. In 1995, when I was 25 years old, I was studying to be a high school teacher, and I was working with kids and went in for just a standard blood test, just to see how my health was and do a health check. And my liver functions came back high, and it ultimately got diagnosed at what at the time was called non-Hep A, non-Hep B hepatitis, which we now know as hepatitis C. And at the time, I said to the university, clinic doctor, I said, "Am I dying?" And he said, "I don't know." And I said, he said, "There's no cure." He said, "You've got to give up alcohol and tobacco." And I'm French Canadian, and those were definitely my drugs of choice at the time. But I made a conscious decision on that day to give up alcohol and tobacco. And I'd been an occasional cannabis user at the time, and I started using it initially to help me deal with cravings of alcohol and tobacco. And ultimately, that led to my finding that it was helpful with the symptoms of my hepatitis C. But I had a lot of difficulty finding a safe, consistent supply. So in 1999, after studying some models in California for compassionate access to cannabis, and also spending some time at Canada's first medical cannabis dispensary, the British Columbia Compassion Club Society in Vancouver, I opened up what's called the Vancouver Island Compassion Society, a nonprofit medical cannabis dispensary to provide medical cannabis to patients in need. So I ran that organization as a nonprofit for 10 years, from 2009 to 2000, or from 1999 to 2009. I took a brief segue. I was elected to Victoria City Council. I was a municipal councillor working on progressive social justice issues, homelessness, harm reduction, and food security. And then the Canadian government started changing the medical cannabis program. So in 2014, I was hired at Tilray. I was the second employee hired at Tilray in February 2014. And then we now have, I think, over 1,400 employees around the world. But it was during my time at the Vancouver Island Compassion Society where I had so many patients every day sharing their personal experiences on cannabis. And yet when I was talking to doctors or policymakers, they would always say, we don't know enough about medical cannabis. We need more research. But no one was doing the research. And so I went back to school and got a master's, and I'm now finishing up a PhD to continue my work and research on medical cannabis to try and capture that patient experience and share it with the world who kept saying, we need more data, we need more research. So I was happy to be able to pursue that, and happy to say that right now there's a lot of opportunities for young academics in this field of studying, therapeutic harms and benefits of cannabis, or even looking at cannabis regulation and how it's impacting public health impacts. So I encourage anyone else listening right now that's interested in this field to consider it as a professional career.
Wow, it's really fascinating how
it's never dull. It's never dull in the cannabis industry. I have a low tolerance for boredom. If you have a low tolerance for boredom, come and join us.
So just to finish up, my last question, as we've been discussing, it's been a real boom in the industry over the past few years. What do you think's next for the cannabis industry?
Well, right now we've got medical cannabis laws in 41 countries, but we've got, practically 200 countries around the world. So we're going to see this constant expansion of medical cannabis. We've got Tilray products are available in 13 countries on 5 continents right now. So we're working hard to continue to build up the science and understanding of medical cannabis. We've got 10 clinical trials completed or active right now. We'll be announcing a number of other clinical trials in the coming months and as well as observational studies that hopefully will add to the overall academic understanding of cannabis as well. Different methods of ingestion are going to be really interesting as we see the professionalization that can happen under a regulated industry. So I think that, and also right now we're mostly talking about medical cannabis as THC CBD. So I think in the future we're going to be looking at other minor cannabinoids. We're going to be looking at slow release medications, and then the flip side, fast acting and fast evacuation medications. Topical patches. We're going to see a lot of novel development in terms of methods of use. And I also think that we're going to see cannabis products being developed that are adjunct treatments to traditional treatments as well. And certainly some of our research is looking at that, looking at not just THC and CBD in isolation, but as combination treatments, for example, for the treatment of nausea and vomiting associated with chemotherapy and that kind of thing.
Mm-hmm. Wow, it's a really exciting time to be in the industry.
I agree, and it's a real honor and privilege to be able to travel around the world, share the work and research that we've been doing for so long, and to help these new jurisdictions find their way around medical cannabis. In Canada we've had this for a long time, but as I like to share with other jurisdictions, I don't want them to just learn from our successes. They have a lot to learn from our failures. And in Canada, for the first 10 years of our medical cannabis program, it was a real disaster. There's a lot to learn there. And I hope that other jurisdictions, for the sake of the patients who need this most, can avoid some of the mistakes that we made and benefit from some of the lessons we've learned.
Mm-hmm. I said last question, but I have to ask a follow-up question there. What went wrong in those first 10 years?
Well, I think that there was active consultation with police and with physicians and with fire departments and with municipal councils and elected officials and public health officials and no consultation at all with patients. So if you're designing a program without talking to the primary recipients of the service you're trying to develop, it's going to be a real challenge to get it right. And so in Canada, we had a program that launched in 2001 called the Medical Marijuana Access Regulations, but it was a total oxymoron. Those regulations were really designed to stop Canadians from having access to medical cannabis. That's not just my opinion. That program was sued over 300 times in the first 10 years by patients, and it was found unconstitutional and thereby acting illegally on 10 different occasions for not providing safe access to medical cannabis for patients. And it took a long time for the government to finally decide to decentralize this program, to realize that this was the access to medical cannabis may cause more benefits than the supposed harms it might cause, and to finally let this program flourish. And certainly in the last few years in Canada, we've seen that as the program has grown from about 40,000 patients to over 350,000 patients right now. The next big step in Canada is to get that medicine into pharmacies, because we still ship out directly to patients. And I think once it's in pharmacies, and it feels like every other medicine in Canada, I think that we can finally look back, those of us who've been working on this for a long time, and see that we've had a good amount of success. Patients are allowed to grow it for themselves in Canada. They'll be able to access it through pharmacies. Once we can take care of healthcare coverage, they don't have to worry about costs, and that is starting to happen through the private payer system. Then and only then, really, I think, will I look back and see that our program's been a success.
Wow, really important takeaways and kind of what not to do's for countries all around the world. Philippe, I want to really thank you for your work and your contribution to the industry, and also for talking with us today.
Well, thank you so much. I really appreciate this opportunity, and I look forward to seeing you more around the world as we travel around and try and bring some honest information, research, and data to countries around the world looking to move into medical cannabis.
Definitely. Thanks so much.
Thank you.